Hello viewers, wish you all a very good morning. I am Aditi Guha, your host for today. So welcome to this webinar on No More Leaks being organized by the Times of India in association with MSN Laboratories. So this webinar today is basically a part of observing the World Continence Week. This week is actually focusing on a certain health campaign to raise an awareness on incontinence related issues. So if it seems to many of us around that this term incontinence is a little difficult, in very simple words, it's all about leaking urine. So this year, this week is being observed from 21st till 27th of June. And during this week, what we will do is we highlight the impact that urinary incontinence can have on our lives. We need to encourage many of us who may be facing this issue. We need to tell them to live happily, to live a good life, and to seek help as and when it's needed. So it's no longer a fact that you need to suffer in silence with an issue that may have some kind of a social feeling for you. So in short, when it comes to a troublesome bladder, we need to get it treated. So that's the basis of everything. And we have here today, therefore, with us, specialists and experts who will guide us through on this entire process. So we will know what this is all about, how we can deal with this issue, what are the ways of treating this issue, and much more. So not taking much of our time, I'd like to introduce our esteemed panel. So they are all very well-known experts in their own field, and it takes me immense pleasure to welcome all our panelists for this discussion today. I have with me Dr. Apul Goel. Dr. Apul Goel is Professor of Urology, King George's Medical University, Lucknow. He is a Master's in Urology from AIIMS, New Delhi. Also with us is Dr. Alok Srivastava. He is Professor Urology, Dr. Ram Manohar Lohia Institute of Medical Science, Lucknow. He has been instrumental in starting renal transplant in RML, as well as advanced laparoscopic surgery. Dr. Srivastava is also the first to start bipolar enucleation of prostate in Uttar Pradesh. I'd like to welcome also Dr. Manmeet Singh. Dr. Manmeet Singh is a renowned urologist, andrologist, and kidney transplant surgeon. He did his master's in urology from SGPGI, Lucknow. He has worked as associate professor in urology, AGMU, Lucknow. Now, at present, Dr. Singh is working as Director of Urology and Kidney Transplantation, Chandan Hospital, Lucknow. Next, we have with us another renowned urologist, Dr. Firoz Mohammad Khan. Dr. Khan did his master's from Christian Medical College, Vellore. He is at present working as consultant in Department of Urology, Sahara Hospital, Lucknow. Dr. Khan's area of interest are uro-oncology, renal transplantation, and advanced laparoscopic urologic surgery, apart from endurology. Dr. Rahul Yadav, our next panelist, is a senior consultant, urology, uro-oncology, and renal transplant at Apollo Medics Super Speciality Hospital, Lucknow. He is former HOD, Rajiv Gandhi Super Speciality Hospital, New Delhi. I extend a very, very warm welcome to all of you panelists and doctors. Thank you once again for coming. I'd like to start with one of the very basic questions that our viewers might have. So I'd begin with Dr. Goel. Dr. Goel, if you could kindly start with a very basic question of what is urinary incontinence?
Thank you, Aditi. If I have to answer this in one line, then urinary incontinence is involuntary leakage of urine. Urination is a voluntary act. It is under our own control. to give you an overall perspective so that the subsequent discussion becomes easier to understand. Urine is produced in the kidneys, it travels via the ureters and is stored in the urinary bladder. The urinary bladder has a capacity of about 400 to 500 ml. It is a muscular organ. It has two basic functions. One is urinary storage and another is emptying. So when the bladder is full to its capacity, an individual has this perception of bladder fullness and passes urine. At the time of urination, the bladder contracts and the urine passes through a tube called the urethra. The urinary bladder, as I said, is a muscular organ. Similarly, the urethra or the bladder outlet is surrounded by various muscles. One is the sphincteric muscles and the other is the pelvic floor. So the urinary bladder and the sphincter and the pelvic floor is under the control of nervous system. Okay, so the urinary bladder and the urethra, for easy understanding, we call it as the lower urinary tract. So abnormalities related to the urinary bladder or the urethra can give rise to urinary incontinence or the support, the sphincters. If there's problem in the sphincters, the urinary bladder or the urethra, the person can have urinary incontinence. Thank you.
Thank you, Dr. Goel. So once we understand the basic of how this lower urinary thing works, my next question would be to Dr. Rahul Yadav. So Dr. Yadav, are there different types of urinary incontinence?
Yes, there are different types of incontinence. Each have different symptoms. To enumerate, there are basically three most common types.
Right.
One is a stress incontinence, meaning people with stress incontinence leaks urine when they laugh, cough, or sneeze, or do anything that stresses the belly, basically. Stress incontinence is most common in women, especially those who have had a baby. Next most commonest type is urgency incontinence. People with this type of incontinence feels a strong need to urinate suddenly.
Okay.
Often the urge is so strong that they cannot make it to the bathroom in time. Overactive bladder is another term for having a sudden, frequent urge to urinate. People with overactive bladders might or might not actually leak urine. The third most commonest is mixed incontinence. It has got a combination of stress as well as urgency incontinence. Other less common types of incontinence are basically overflow incontinence, meaning this type results when a person is unable to empty their bladder completely and bladder is almost full and it overflows all the time. In cases of obstruction, sometimes in diabetes and other patients.
Okay.
Another type is a functional incontinence. Functional is basically more with the logistics to get to the bathroom in time. The people having disabilities in terms of mobility or having confusion, those who are bedridden. And the last one is total incontinence. The bladder doesn't have a capacity to store, it leaks all the time. That is all.
So, thank you, Dr. Yadav. So that gives us an idea of the various kinds of urinary incontinence we have and basically the factors that lead to it in short. I'd like to ask Dr. Alok Srivastava next. Who is the primary section which gets this kind of urinary incontinence? Dr. Srivastava, if you could kindly unmute. Yeah.
First of all, I would like to congratulate TOI Group and MSN Group for bringing forth such a problem, which till now is a social taboo. People think about it, don't come forward, and in turn they suffer more and more, thereby worsening their disease. Now, to your question that who actually gets urinary incontinence. So it is a major problem for the females, mostly. I think females suffer 3 times or 4 times more than the men. And reasons are unique to childbirth, to the basic physiology of their musculature, short urethra. About 1/3 of women who are above 65 years of age do suffer from certain kind of incontinence. It might be mild, it might be severe. Men do suffer from incontinence, especially older men with prostatic problems. people who might have undergone certain surgeries, pelvic surgeries or prosthetic surgeries, thereby causing damage to the musculature or to the nerves. People having certain neurological diseases like Parkinson's, like multiple sclerosis, people who have had a stroke, psychiatric patients taking certain kind of medications. It is now very well known that this is a vortex of a problem. People who have had this overactive bladder or incontinence they do tend to have more of psychiatric issues like anxiety, depression, which tends to decrease the serotonin levels in the brain, which indirectly leads to decreased bladder capacity, thereby worsening the problems. There are also certain situations in children where they affect from congenital anatomical abnormalities, thereby reducing the bladder capacity and thereby causing incontinence. So these are the major sections of the population who might get incontinence. But it is still a disease or a condition which mainly affects women, and especially older age women. But it can happen to anyone above 40 years usually.
Yeah. So as you just said that it can happen to anybody above 40, taking a cue from there and the fact that women possibly may have it more than men or children, I'd like to ask Dr. Khan, why is it that women, if you can go into the depth a little, please, sir, why is it that women have more of this urinary incontinence issue?
Yeah, thank you. Basically, as Dr. Srivastava was saying, that this problem is more frequent or more common in females. Yeah, it's true. And the basic reason behind that is there are certain unique features, unique events that occurs in a female patient's life, like pregnancy, childbirth, and then after a certain age, the menopause that occurs. At menopause leads to, because of that menopause, the hormonal changes occurs in the body, and that leads to it affects the events affects the musculature around the urinary tract system and the pelvic floor muscles. So what happens is that the pelvic floor muscles becomes weak, and these muscles which surrounds the bladder, urinary bladder, the urine passage, that is urethra, the uterus, and the intestine. So these muscles becomes weak or they get damaged. That it leads to the support system to the urinary tract becomes weak, and then the urinary bladder has to work hard. Means they have to work very hard to prevent the leakage of urine. So in that events, any pressure, any abdominal pressure, or any extra stress onto the bladder leads to the leakage of urine from the urethra. Also, the female urethra, as already is mentioned, that is shorter than male. So the muscular, the support system is also very less as compared to the males. So these are the two major reasons why the females have more urinary incontinence as compared to males. And the point to note is that the women, they suffer more because of incontinence. And these are this group and the older age group. They are the people who usually they don't go to doctors as frequent to the other group of other gender group or the other age group to seek their help or solution to their problems.
Yeah.
Thank you.
Thank you, Dr. Khan. And as you correctly said, and also Dr. Srivastava, as he mentioned, the social taboo about this entire thing is something that has to be dealt with very seriously. So now that we have a basic idea of what exactly urinary incontinence is, I'd like to request Dr. Singh to throw some light on what could be the normal symptoms.
Okay, thank you, Aditi. Like as all the esteemed panelists have told something about incontinence, like the symptoms of the urinary incontinence will be according to the type. As Dr. Rahul told, if the continence is of stress urinary incontinence type, then the patients may have urinary leak while they stand up from the stool, they walk, and like they do their activities in the gym. Like these all are the things during which they can have the leak. This is the symptom. Like then again in urgency incontinence, like whenever they get a call to urinate, they won't get that sufficient time to reach the bathroom and they will somehow urinate. So this is urgency, present as urgency incontinence. Patients can also present, they have both the symptoms of stress and urinary incontinence. They may have symptoms incontinence while coughing also, and then they may have leak, then they may have less time to reach the bathroom. Also then, like if it is a functional incontinence, then they may have problems because of the arthritis. If a patient is having arthritis, he cannot reach the bathroom, and then they may have urinary leak like this. Even kids, now teenagers, in 2 to 3% of cases, teenagers have this problem of urinary incontinence. And so all the symptoms like spotting, if a child comes with a spotting of urine on his pants, then he should be evaluated by a urologist. Or if a elderly patient comes with bedwetting, patients can present symptoms that my bed sheet becomes wet in the night. So this is a type of overflow incontinence which happens in males mainly. And then in patients who have long-standing diabetes leading to hypotonic bladder.
Yes, we just mentioned.
These are the symptoms which, these are the ways in which incontinence can present. They can present as symptoms.
Right. Thank you, Dr. Singh. So while we have already spoken about, the stress factor and the other factors that actually lead to this kind of, I'd like to ask Dr. Srivastava again. There could be a small amount of urine leakage. There could be a whole lot of urine leakage. So basically the causes we have just spoken about, but anything in depth which can lead to, this difference in amount or, the leakages basically?
Probably it's due to the basic etiology of the disease, what actually is the cause of the disease. Some people with, I've already discussed that females who have history of vaginal childbirth, instrument delivery or vacuum deliveries, these women tend to have a greater degree of incontinence because of the way the delivery was done. Their pelvic musculature, as Dr. Apul already told, there are various different causes of incontinence. It might be due to the bladder, it might be due to the pelvic musculature, it might be a sphincter issues. So such women tend to have all these kind of issues, especially with the musculature and the sphincter muscles. So these females tend to have a greater degree of incontinence, probably because in certain people who tend to have a mild degree of incontinence, they tend to contract their muscles at the appropriate time to prevent further incontinence. But such females or some certain male patients who tend to ignore their symptoms for a greater period of time, for a longer period of time, and people who have had chronic constipation for a longer period of time, who strain their muscles to actually evacuate their bowel, they tend to chronically affect their bladder muscles and the pelvic muscles also. So then these muscles, first they try to overactivate, try to work hard, but soon they lose their strength. So people usually who have a greater degree of incontinence are people who in whom musculature is actually very weak, or people who are actually suffering from certain neurological problems because their bladder sometimes becomes asensate. It does not sense urine, so it tends to collect when the collected urine tends to just evacuate all of a sudden. Especially in patients, also in patients who have long-standing history of prostate. They tend to hold urine for a longer period of time, and then they forcefully evacuate the urine. Their bladders tend to over-distend, thickened, and then they start having overflow incontinence. The bladder becomes asensate, it stores a large amount of urine, and then suddenly when the capacity gets crossed, they suddenly evacuate the urine all of a sudden. So these are certain causes why the degree of incontinence differs from people to people.
Yes. Thank you, Dr. Shwas. I'd like now to move on to another aspect. Dr. Goel, if you could kindly help us out with your views on how this incontinence progresses.
So till now, whatever the discussion has been, the listeners must have understood that there are different causes of incontinence. Okay, so giving a straightforward answer is a little difficult. So depending on the cause of urinary incontinence, if there is diseases of the nervous system, for example, that is causing problems in the nerves of the urinary bladder or the sphincters. So this is called neurogenic bladder. So the treatment is different, and of course the progression is different. You need to treat the primary disease, and then accordingly the incontinence will either improve or deteriorate or stabilize, whatever. Okay. For this discussion for the general public, I think there are two most common types of incontinence that Dr. Rahul mentioned. One is overactive bladder and another is stress urinary incontinence. 90% of urinary incontinence are primarily these two incontinence. Okay. So if there are certain longitudinal studies where they have seen the progression, how it progresses. Okay. Another thing that has already been highlighted, urinary incontinence can start in early age, even in adolescence or young age, but primarily it is more common in elderly population. So the longitudinal studies that have been performed, they have shown a dynamic type of progression. If I talk about overactive bladder, the overactive bladder may worsen. A person who may have only urgency may subsequently develop urgency incontinence, right, or it may stabilize. It may even, there may be periods of remission. Okay. So it's quite variable, but typically it is considered a lifelong disease. Similarly, stress urinary incontinence, if it is not corrected, if it is not treated, again, it is the progressive disease. Okay, so this point needs to be understood by the patients, because often what happens, when once they are put on some medications, the dropout rate is very high for urinary incontinence, because if I talk about these two types of incontinence, overactive bladder and stress urinary incontinence, primarily it is a quality of life disease. Okay, so what happens? The patient need to be committed to treatment. So what happens? They take treatment for 3 months, 6 months. By the end of year, most patients, they stop treatment and the symptoms come back. Okay, thank you so much.
They come back. Yes, yes. So this is actually an area of concern, as you just said, that, once we carry on the treatment and possibly with some change here, there, the patients often tend to drop out or, stop the treatment. So that is a very risky area, I guess. And I'd like to now ask Dr. Yadav. See, we have spoken about how all these issues are happening, what are the basic sources and what are the causes. So how do you diagnose? Is it only about, say, a person realizing that there's a spot, or is it just a feeling? How is it basically diagnosed? And what is the diagnosis from your end when somebody comes to you with this kind of a problem?
Important piece of information for the diagnosis is from the symptoms and medical history of the patients. I mean, symptoms like how often they empty their bladders, how and when they leak urine, how much amount of urine they leak, when their symptoms have started, what medications are they taking. And one of the most important clue to the diagnosis is by their bladder diary. What is actually a bladder diary? A bladder diary is basically a 1 to 3 days track when they empty their bladder or they leak urine and what amount of urine they leak. So by all these symptoms, medical history, bladder diary, we need to first diagnose what is the type of incontinence. Is it primarily stress, urgency, or a mix of both? Then a physical examination is very, very important to rule out some neurological problems. And then some other tests in the form of flow rates, ultrasound, and a special test to know the bladder dynamics, which we call as a urodynamics, which will ascertain the type and probable cause of incontinence, and which helps in treating patients on case-to-case basis. So first of all, first to diagnose the type of incontinence, and then try to find out the cause, and then to treat the cause.
Right. So when we are talking of treatment, Dr. Yadav, I'll move on to Dr. Khan for this. So what are the basic treatment options? If somebody is to, go to you with a problem, maybe not a very advanced stage, but then somebody reaches out to you with this kind of, maybe it's an urgency-based problem that they're facing. So what are the various treatment options that we may have?
Basically, treatment of urinary incontinence depends upon three factors. The first is the type, which type of incontinence it is. It is either it is a stress incontinence or a urgency incontinence. Second is the severity of the disease. Either it is a mild, a very small, few amounts of urine leakage in a daytime, or it is a moderate kind, or it is a severe type of incontinence. The third is the underlying cause. What is the cause of this incontinence? So, first of all, then the treatment category being categorized into three groups. The first is the conservative treatment. Second is the medical medications, and third comes the surgery. So the first treatment, which doesn't involve medications or surgery, is called the conservative treatment, or we can say a behavioral therapy. So this behavioral therapy includes lifestyle changes. Lifestyle changes means we have to reduce the fluid intake to a certain limit, like we should not take excess amount of fluids. If the person is taking alcohol, he has to avoid the alcohol intake. If he is smoking, stop smoking. If patient is having constipation, that has to be taken care of. And then there comes the exercise of the pelvic floor muscles, that is the lower abdomen and the pelvic region muscles exercise, and it's commonly known as Kegel exercise. Most of the people, those who suffer from this problem, they know about this Kegel exercise. And then next comes the training of the bladder, that is exercising the bladder. So if there is an episode of urgency comes, we tell them to try to prevent the going to bathroom to a certain limit of like 5 minutes or 10 minutes, just to delay this process. That is called the bladder training. And then comes the medications. If the patients are not responding to the behavioral therapy, then medications comes. And medications, there are several kinds of medications. First group of medications which relaxes the bladder muscles, so to prevent the excessive contraction of the bladder, so the incontinence can be treated. The second group of muscles medications are those which relaxes the muscles of the bladder neck region, and it opens the bladder neck properly, so that urine it facilitates the passage of urine. And third group, which is not very effective, but sometimes they say that it prevents the stress incontinence also. So these are the medications. And then when the medication doesn't help, then or in cases of like stress incontinence, especially, most of the time the patient doesn't respond to medications. Either they show response to behavioral therapy, or otherwise they have to undergo surgery. So these are the kind of treatments which we have.
Right. So medication, lifestyle changes, these are all there at the initial part of the treatment.
Yes.
And Dr. Goel, if we can just throw some light on, as Dr. Khan just mentioned, that after a certain point we need surgery. So how important is surgery or implants in this kind of incontinence, dealing with incontinence?
Okay. So let me tell you, let us focus, because as you must have understood, it is a heterogeneous. See, urinary incontinence is just a manifestation. There are so many different causes of urinary incontinence. Okay, so in fact, let me bring this new term which has not been discussed till now, which is called as pelvic floor disorders. Okay, so urinary incontinence is one manifestation of pelvic floor disorder. If there's weakness of the pelvic floor, so it might lead to stress urinary incontinence. But patients who have cystocele or uterine prolapse or rectocele, treating urinary incontinence in isolation doesn't work. In fact, if you treat these prolapses, many times incontinence that was hidden initially starts manifesting. Okay, so when you are treating surgically, see, as Dr. Khan mentioned, most of the patients, primarily those patients who are suffering from overactive bladder or isolated stress urinary incontinence, can be managed medically or by lifestyle changes. Okay, but patients who need surgery in those two categories are primarily limited. There are not many. But patients who are having pelvic floor disorders or weakness in the pelvic floor, they of course need surgery. Okay. Surgery can be endoscopic surgery, or it can be a laparoscopic or an open surgery. patients who have overactive bladder, if they don't respond to medicines, there's a therapy called where you inject botulinum toxin within the urinary bladder. Typically, it works for about 9 months to a year. If that fails, then you can perform either laparoscopic surgery or open surgery where you can augment the bladder. There's another method called sacral neuromodulation, but in India, it is not very, it's not widespread. It's rarely used in India. I think only few centers are putting this implant in the back. Right. So the patients might improve overactive bladder. For stress urinary incontinence, primarily there are two broad categories of surgery. One is called the suspension surgery, retropubic suspension surgery, or there are various meshes, which is called the sling surgery. Okay? So these are the two types of surgeries for stress urinary incontinence. But if it is part of pelvic floor disorder, you need to correct that as well. Okay? Thank you.
Yeah. Thank you, Dr. Goel. So when you talk of suspension, which I just say, I'll just take a minute on this. So is that just holding forth the muscles, tightening of the muscles and seeing that, the bladder is well equipped to work in a better fashion? Okay.
So if I need to again simplify things, overactive bladder is a disease of urinary bladder where the storage function of the urinary bladder is impaired. It doesn't allow storage of urine and contracts in between, so the patient leaks. Then there is problem of outlet. There's pelvic floor and there's sphincteric muscles. So what happens, as has been discussed repeatedly by the previous panelists, what happens, the pelvic floor gets weakened in women, okay, because of childbirth and because of part of aging. So the pelvic floor becomes weak. So what happens, the urinary bladder and the urethra sags. There's hypermobility of the urethra or the bladder, the support, the pelvic support is weakened. So the bladder shifts a little down. So what we do, we pull up the bladder. Okay. Right. So in suspension procedure, we pull up the bladder to its more normal anatomical place, or we support the urethra by putting in a sling. So that increases the outlet resistance, you can say. In simple terms, it increases the outlet resistance and prevents urinary leakage.
Right. Thank you so much, Dr. Ghosh. Dr. Srivastava, my next question would be to you. We have gone into depth on the surgery part, but if there's some basic thing that we begin with, that is medication, as we all discussed. So what could be, some of the medications that people can start with for dealing with this?
See, Dr. Goel has discussed in detail about the surgical part. Medications are usually for people who have mild to moderate disease, or to reduce the severity in cases of severe disease. But for me, the treatment of incontinence, especially the medical aspects, especially those related to bladder issues, it needs a holistic sort of scenario where there should be proper lifestyle changes, behavioral therapies, reassurance that you don't have a disease which is going to affect your life expectancy. They should be taught to be happy, especially in these COVID eras where there's lockdown situations. People have histories of worsening their this condition. So they should be, and they should be happy. They should do meditation, yoga, so that to increase their serotonin levels. And then the role of timely medication comes. There have been many sorts of medications, especially those which act on the bladder. There are certain kind of nerves in the bladder or nerve receptors in the bladder. There are cholinergic receptors. There are alpha-adrenergic, beta-adrenergic receptors. So research is already going on in this field at a very rapid pace. People are coming up with new and new medications which are safer for the patients with the less side effects. So most recent one is a beta-3 agonist medication that is mirabegron sort of thing, which comes in 25 milligram and 50 milligram doses. These are considered to be safe and have usually less side effects as compared to other medications. Then there are M3 receptor antagonist medications. So these medications are there which tend to calm down your bladder. which tend to reduce your disease severity, reduce your urge symptoms. And then there are certain medications which usually focus on your sphincter. They have a unique mechanism of action, which is, I think, beyond the scope of this webinar. So there are medications, but they have a doubtful efficacy. In some people, it might work. In some people, it doesn't work. And then there are certain other medications, like Dr. Apul said, there are botulinum toxins like Botox injections, which are given. So primarily the main drugs are these beta-3 agonists and these M3 receptor antagonists. So these are the most commonly used drugs, and these are effective too in 60 to 70% of the scenarios.
That's really an insightful thing into this, Dr. Srivastava. So, Dr. Yadav, I just kind of ask you one thing, that what do you think are the key problems that a patient might face? If there is a physical condition, they also have some kind of a mental, trauma with all of this. So what are the problems that they may actually face in real life?
Problems with the urinary continence, as Dr. Apul has rightly pointed, they impact quality of life. It's a day-to-day life which is affected. And it also restricts their social interactions. It can affect social work, personal relationships as well, because patients are leaking urine. They have a fear to go out, they have a fear to go to work, to any places. Some patient might smell also. So even with the amount of stress, the people, those have a stress incontinence might leak because of physical activity. So they might decrease their physical activity. It affects their sexual life. In fact, it affects all part of the life. And apart from this, there are complications related to the wetness, the skin problems, rashes, infections. And because of their illness, because of their problems, some patients are catheterized. So catheter-related infections, people are on medication because of neurological disease or some other diseases. So medication-related side effects. Eventually, in longer run, if not treated adequately, it might lead to depression and even complete social isolation. So these are the basic problems with urinary incontinence.
Right. Thank you. Dr. Khan, one more area that we would like to throw light on is what happens if this incontinence is left untreated for a long time? There may be a lot of people who deter on going for treatment. They may think twice on going for treatment, as we were just discussing. So what happens when it's left untreated for a long time?
Yeah, it's a very good question, actually, because as we all know, that patients, they don't seek help for the problems when it starts, like when it is an early phase, and they try to either avoid, or then they try to take over-the-counter medications, and they only go to doctors when the severity increased, or when it is not being treated by themselves. I'm just saying that it can cause worsening of the problems. So what happens if it is left untreated? And if for a duration of period of time, it affects the mainly it affects the bladder, it affects the kidneys, because if it is not being treated, the bladder gets infected, the chronic infection of the bladder, then chronic or severe infection of it spreads to the kidneys. So it might lead to infection of kidneys that is called the pyelonephritis. Sometimes prolonged infections or prolonged these left untreated, this problem leads to the permanent damage to the kidneys. So sometimes the patient becomes the chronic kidney disease patients. They may land up in dialysis also at a very advanced stage of period. The other thing is that sometimes it has been seen that these urine incontinence is sometimes an early sign of any malignancy, any cancer, or any nerve damage. So that also needs to be taken care of, or needs an early diagnosis. If we start seeking the diagnosis, we might find out some underlying cancer is there, or some underlying nerve damage is happening. So that is the reason it is very important to seek treatment early. And if left untreated, it leads to the serious problems of the kidney infections, the bladder infections, and then apart from the problems which Dr. Rahul has already mentioned, the physical, mental health, their social life, every aspect of the life gets affected. So thank you.
That's right. Thank you so much, Dr. Khan. So this is actually a word of caution that sooner the better. We need not sit through this kind of a problem to, aggravate because we know it might have repercussions elsewhere also in our body.
Yes.
Dr. Singh, we have spoken about, lifestyle changes, yoga, etc. So what according to you would be some of the best ways to cope with this for the patient and for people around? Say if somebody in the family has it. So how do you think the family members or caregivers for elderly people, how do you think they should cope with this entire stuff?
So very pertinent question, because although we spread awareness, but the first thing a person can do is whatever he can do on his own at whatever is available to him. So medicines and surgery have a role, but to cope up for the first time, they need to have lifestyle changes, as all the panelists have already told. So it has already been told, but I'd like to emphasize on this. Like lifestyle changes is almost 50% important as medicine. So it has as good as a role as medicine if a patient is properly following the lifestyle advices. Like the first lifestyle advices, like patient need to do some physical work. Nowadays, all of us are eating junk foods and the waist size is increasing. So if people are focusing on BMI, if they are doing lifestyle changes and they are reducing their weight, if weight is reduced, if the belly is reduced, then the pressure on the pelvic floor automatically gets reduced. And if along with this general reduction of weight and BMI, if they are doing focused exercises for the pelvic muscles, like as previously told by speakers, that Kegels exercise. Kegels exercise, I'll try to explain in short. Like there are two methods. What I explain to my patients, that the easy way to follow practically. One is you have to hold you have to do the exercises like you hold your urine, or whenever you feel like doing a potty, you constrict your muscles around your anus. So this has to be done at least 10 times in one go, and it has to be done 5 times a day. So this seems like a very simple exercise, but it has been described in our yogas also as mool bandh. In mool bandh, they say you have to constrict your anus and then you have to hold it for a few seconds, and then you have to do it repeatedly so that your pelvic floor gets strengthened. And then a very easy way is to put a small pillow which is available in your house, fold the pillow and put it in between your knees, and then press the pillow and count up to 10. Then in that way you are tightening your muscles. You can feel the medial part of your thigh and see that whether your exercise is effectively constricting and relaxing your pelvic muscles or not. So like lifestyle changes like weight reduction, focused exercises of the pelvis through yoga or other exercises. Along with this, you have to quit things like alcohol. Alcohol indirectly increases weight, and it has other benefits. It can lead to incontinence. Smoking, because of smoking, the tissues get weak, and thereby we get because of weak tissues, the muscles get loose, and we suffer from incontinence. Then patients can avoid caffeinated beverages. These things can lead to incontinence. Very commonly, people have a myth that the more water I will take, my kidneys will function better. And the first thing they do after wake up is they take 2 lotas of water in afternoon, and similarly before sleeping they'll take a glass of milk. They'll have 2 lotas again. How much medicines I give, if your intake of water is more than the required, you will obviously leak. You have to go many times. You'll have that urgency, that if not leak, incontinence sort of picture. So you have to limit your water intake. You have to see what type of liquid you are taking. You have to avoid caffeinated beverages. Along with that, these are like these are the first things which patients can do as lifestyle change to cope up with the urinary incontinence. Once after all these things, most of the time, 50% of the symptoms will wane away with these things. And once these symptoms don't go completely, then they can go to medicine as told by Alok, or go for surgery as told by Dr. Apu.
Thank you, Dr. Singh. So in a crux, what we understand is lifestyle diseases, small little things that we can do on our own are the beginning points. So once we start doing that, possibly the positivity comes back also in us when we see some kind of, things progressing better. So that is the first.
You mentioned about yoga also, and like incontinence indirectly leads to depression and anxiety. And this yoga, along with meditation and everything, gives a holistic benefit to the patient.
Absolutely. So these are small things, as I just say, the first steps to, check the problem. And then further, if there's anything more that we need to, of course, take absolute medical help. One question that comes to mind is, are there any kind of products? I'll leave this question to anyone of you. Any kind of products that can be worn or that can be used to kind of deal with this incontinence?
Okay, I'll take the products like for adults till the moment they reach to the doctor, because since it's a COVID time, so many of the time patients cannot reach up to the doctor.
Yes,
they have to they can take the medicinal advice online, and then the products which you're talking about, then we have adult diapers which are commonly available everywhere. So you have to frequently use adult diapers. Close to, depends on the amount of incontinence you have. Adult diapers are very helpful. The esteem of the patient comes back. They can go and meet people at least. Sometimes in certain situations, like we have to catheterize patients, although always catheterization does not help in incontinence. But sometimes if it is an overflowing type of incontinence, when adult patients with a huge prostate, they develop a big bladder, then the only way to improve incontinence is a product called Foley's catheter. You can insert a catheter and then the incontinence can improve.
Right.
I would like to ask other panelists if they can suggest any other product.
For total incontinence in males, there are penile clamps which can be used. Females can use certain kind of undergarments which have certain type of paddings. But these are helpful in mild cases only, not in severe cases. But diapers, as Dr. Manmeet has already discussed, they can be used, and they can be used when people are going out on some errand. They are going to meet some people. So they should actually use it, and they should actually go out and meet people. If they are going to self-isolate themselves, it is going to worsen their disease. It's going to worsen their mental problems. So actually, there are methods, like you said, what can be done with the family people. So people with these sort of problems should be open to their family members. They should discuss their problems so that automatically they will give their love and support in most of the situations. And they would not have to use diapers in the home. They can just do with simple undergarments, and people will accept their condition, and they will give their love and support, and probably, if not completely, it might partially improve their symptoms and their lifestyle.
That will be a mental strength anyway. Yes. So we have a couple of audience questions that have come in. I'll take some of these quickly. So it says, how does incontinence relate to diet? For instance, does a spicy diet aggravate the human system? So, can I ask Dr. Goyal kindly to answer this, please?
Okay, so Aditi, I think this has been highlighted many times, just for clarification. So let me tell you, diet doesn't cause incontinence, okay? But it might aggravate. So especially patients who are suffering from overactive bladder. So it has been seen, as has been highlighted before also. Okay, before that, let me clarify. See, scientific studies on diet are extremely difficult to conduct. Okay, so you can't have two groups of patients. One is given a particular diet and another is given a particular diet. You cannot control someone's diet actually for a month or so. So studies, the evidence that we get from such studies is typically not very strong. Okay, it's only sort of a demographic study where you just see whether patients who are suffering from incontinence, whether there's something in their diet which is aggravating. It's like this. So the evidence that we have is not very strong. The reason being, as I told, conducting such studies is very difficult. Okay. So as has been highlighted, spicy food, carbonated drinks, caffeinated drinks, alcohol, smoking. So all these tend to aggravate the symptoms. In fact, there has been studies that have shown that if you alkalinize the urine, okay, so it improves the symptoms of overactive bladder. Okay.
Right. Thank you, Dr. Goel. There's another question. I'll kindly request Dr. Yadav to answer this. What is the ideal amount of water to be consumed for people with this condition? Is there a fixed amount that they should?
Yeah. What we say is the ideal amount of water to be consumed is such that the patient is able to pass at least 1.5 to 2 liters of urine in a day. To elaborate it more further, usually the water which patient takes or anybody takes comes out by 4 mechanisms. One is by urine, another is by respiration, third thing is basically in stools, and the another thing is basically the urine which comes out. So urine, respiration, stools, and these things. So round about 500 to 700 ml of fluid, what everybody takes, comes out by 3 mechanisms: respiration, stools. So rest all is by passing urine. So if we take calculated as an insensible loss, if we take 500 to 700 ml plus, suppose we take 3 liters of water in a day. So 500 or 700 ml water is round about an insensible loss, and rest will be passed out through urine. So for producing 1.5 to 2 liters of urine in a day, in summers one has to consume 2.5 to 3 liters of water or fluids in any form. And in winters, you can reduce it to 500 ml less because the sweating is less in winters.
Right. Thank you, Dr. Yadav. There's one more question here which says, there are many drugs that are being prescribed these days for incontinence. Are there any side effects of these drugs? Dr. Khan, if you could kindly share your views on this, please.
Yeah. We have already discussed the incontinence, the type of incontinence, then their treatment, behavioral therapies, medications, and surgery. Now, the medications. There are several medications, as already been described, about that those helps in preventing the incontinence or in treating the incontinence. There are definitely some side effects also with these drugs, and most common side effect of these drugs is the dryness of mouth. The dryness of mouth, the dryness in the nasal decongestion, the dryness in the nose, and then constipation. These are 3 main problems which comes with this. And in certain cases, when the post-void residual urine is high, especially in male patients with the prostate, if they have urgency incontinence with the significant amount of urine being left after passing of urine, that is called the post-void residual urine. In those patients, if they take these medications, they may land up in complete blockage, like the retention of urine. They don't able to pass urine. That's called retention of urine. That is one of the complications of these drugs. So, and one drug which is now the recent drug, which doesn't have these side effects, is the mirabegron. So that is why this mirabegron is being promoted more, that it doesn't have the retention of urine problem. So these are the common side effects of this.
Thank you, Dr. Khan. Okay, this is a very, very common question. This has come from multiple sources. They say swimming, walking, etc. removes stress from the body. So would you recommend that these are some of the ways to deal with body stress, or whether they would not be right for incontinence? Dr. Goel, if you could kindly help us on
that. Swimming and walking, you say whether they aggravate or not?
Yes.
What is whether they
okay? Because they beat stress. So on one hand, they're helping, but on the other hand, do they aggravate this incontinence issue?
No, I don't think so. But let me tell you, sports women, okay, athletes, they have 3 times higher incidence of urinary incontinence as compared to normal women, those who are not in active athletics. Okay. So, but swimming and walking, to my mind, because if you are strengthening, if it is part of Kegel exercise or pelvic floor exercise, then there's no need to worry. It will not aggravate your symptoms. Okay. So there's nothing against, you can do it.
Right. Thank you. I'll take maybe 1 or 2 more questions. Sometimes we are told that low or less intake of water may reduce oxygen level in body. Is that true? Dr. Singh, if you could kindly answer this. Low intake of water that can reduce oxygen level in the body.
No, oxygen does not depend on the water. Actually, it is more you get it from the air. It is not from the oxygen water. But you should always drink the adequate amount of water. What I say practically, it is very difficult to measure whether you urinate 2 liters of urine or urinate 2.5 liters of urine. It is the color of the urine which decides how much is the adequate amount of the water you have to take. So if your urine is transparent color, then it is the adequate amount of the water you are taking. It can be like 1.5 liter for somebody, it can be 2 liter for somebody, and it can be 3 liters. If a person who is doing a physical work and and having a lot of sweating, then he has to take, and then his adequate amount will be 3 liters. So low water as such will not lead to oxygen, but water and air both are necessary. Both are required.
Right. Thank you. Okay, this also is anything regarding urine, cranberry juice. How important is cranberry juice and how does it help in urinary tract, keeping the urinary tract clean and clear? So maybe Dr. Yadav.
As such, if we talk about diet, as such, one should have a healthy diet, means adequate amount of carbohydrate, fats, and proteins. One should take. Regarding this cranberry juice, I mean, the people who is having recurrent urinary tract infection, especially in females, it might reduce the frequency of it to a little lower. Just having a cranberry juice and saying that somebody is not going to get a urinary tract infection or somebody is going to get free from the bacteria, it is not possible. It might help in patients who have recurrent UTIs to reduce the frequency to a little bit lower. That is all.
Right. We are almost towards the end of our discussion, which was a fantastic learning for all of us from all you experts. So thank you, doctors. Thank you so much for being with us. And, the lucid ways in which you all explained the basis of this problem and how to go forth, how to deal with this, how to actually address this issue, not to have a mental block, not to think it's a social taboo, to come forward, to reach out to you all for the right treatment at the right time. That is by far the most important thing, I guess. So while we wrap up now, there's just one positive message from all of you, from all of us here, that we should never hesitate. We should never hesitate to come forth with any kind of problems. So even if we have this kind of a problem, I don't think it takes us 2 minutes to reach out to our doctors, because they are the people who will show us the way forward. And that is where we can have the checks and measures at quite an early time. So let's all join hands together. And, what we need to do is live happily and break the silence. So thank you so much, doctors. Thank you for being on our panel. It has been a very insightful discussion. Thank you.
Thank you very much.
Thank you.